So I just want to begin by acknowledging that I'm currently presenting from the unceded and traditional territory of the Stolo Nation, and my practicum was with Dr. Matthew Little. So I'm a settler with South Asian ancestry, and I was born and raised in Abbotsford, BC, also known as the Stolo Nation, and I have a strong interest in reducing inequities. And so this is the agenda for my presentation today, and I'll begin with a summary of my practicum placement. So for the last 4 months, I've been completing my practicum with Dr. Matthew Little, and he's a assistant professor in the School of Public Health and Social Policy, Faculty of Human and Social Development. And his research works in part on reducing food insecurity, but he also has a global health emphasis. And I specifically focused on evaluating two programs, one being the Nanaimo Food Share Good Food Box program, and the other one is the Guelph Community Health Center Fresh Food Prescription program. So this was definitely a more research-based practicum. So there were two major tasks that I had in this practicum. The first one being quantitatively analyzing the Guelph Community Health Center's Fresh Food Prescription program. So I started off with producing descriptive statistics of participants in the program. So this was my first time using Stata, so I had to understand how to use that software. And then I produced t-tests and bar graphs and pie charts to understand how participants were impacted by the program, so like their food consumption, their food security, and health outcomes. And then in the end, I also produced a few short briefs to summarize these results. And then the other part of my practicum was to create a plain language report using semi-structured interview data that was collected by the Little Lab from staff, volunteers, and community partners of the Nanaimo Food Share. And then I did a thematic analysis using NVivo and the RE-AIM framework. And so while completing these tasks, I was able to learn many skills such as communicating health information effectively with interprofessional teams and communities. So while creating the plain language report, I gave priority to universal design principles, such as having a simple layout and accessible terms and fonts. And then my understanding of universal design definitely comes from a podcast by Helen Osborne that was talked about in one of the health literacy courses. And she mentions how our population is aging, and with aging comes many limitations. So it's important that we produce information, or we do knowledge translation with accessibility in mind. But I also practiced that skill by communicating regularly with the Little Lab and also the team in Guelph. So while completing my practicum work, and especially while completing the process evaluation of Nanaimo Food Share's Good Food Box program, we had our work directly aligned with the value of community-based approaches to knowledge and research development. So in the process evaluation, our work directly aligned with the community-based approach, the community-based participatory action research written in Burns et al. So for example, through the use of semi-structured interviews with staff, volunteers, and community partners, we were able to talk openly about concerns in any areas of improvement or suggestions. So the evaluation really thrived with community engagement in the research process, especially through primary data collection methods such as interviews. So while listening and transcribing the interviews related to the process evaluation, I was given the opportunity to really analyze the determinants of health, including, for example, access to services or physical environments. And I noticed that there are many differences in how these determinants are experienced by people. And these differences are often unfair, which is why, as we've learned, they're called inequities. So I really realized that to improve health outcomes, it's important that we pay attention to addressing these differences. So while creating the plain language report, we emphasized many determinants of health. For example, we mentioned that access to the Nanaimo Food Share's Good Food Box program is impacted by factors such as age or mobility. So for that reason, they should work on improving the sign-up process or expanding the delivery process so it's made more accessible. And now that I'm done the program, I plan to operationalize the Truth and Reconciliation Call to Action number 20. So it's in order to address the jurisdictional disputes concerning Aboriginal people who do not reside on reserves, we call upon the federal government to recognize, respect, and address the distinct health needs of the Métis, Inuit, and off-reserve Aboriginal peoples. So one way that I plan on doing this is by involving Indigenous communities in my master's research, since I'm interviewing individuals who've crowdfunded for health needs to understand privacy issues that arise. So this is also a good opportunity to understand the gaps that exist in our current health services. But I do recognize that it's important to first work on building a relationship with Indigenous communities and then allow them to actively decide whether or not they would like to participate. And that's something that Natalie has mentioned to me. So one of the most meaningful components of my practicum would have to be creating the plain language report that's going to be shared with Nanaimo Food Share and then maybe the wider community. So this made me feel like I indeed contributed to the betterment of society and people's health. And the most challenging aspect of my practicum would have to be understanding how to use new software like NVivo and Stata, and also the thematic analysis and transcribing interviews. But I've learned that consistency is a major factor that leads to accurate research reporting, which is really important. And that's something that I'm continually going to work on. And lastly, I just want to say that one of the greatest highlights of my bachelor's would have to be the support that each professor gave me, or everyone, including the time that they set aside to answer students' questions and the encouragement that professors continuously gave students. I will always be grateful for the opportunity to learn from many Indigenous scholars. And lastly, I want to say a thank you to Dr. Matthew Little for being supportive throughout my practicum, and Heather and Natalie for being so great at answering students' questions and addressing any concerns. The values and ethical grounding that this program has provided me with will definitely guide me throughout my future career. So thank you, everyone. And here are my references.